How do we reconcile germline gene therapy with religious views? Imagine a future where we can edit the genes in our eggs, sperm, or embryos to prevent serious diseases from passing to children. It sounds promising, but it also raises big questions. How do different faiths see this kind of powerful technology? Can science and religion find common ground? Let's explore how we can balance these perspectives. Germline gene therapy involves changing the genetic code in reproductive cells so that these changes are inherited by future generations. Unlike treatments that only affect the person being treated, germline modifications are permanent and affect all descendants. This makes it a very sensitive area, especially when considering religious beliefs about human life and natural order. Medical ethics principles guide us here. First, autonomy is challenged because future generations cannot give consent. We are making decisions for people who are not yet born. Second, beneficence suggests that if germline therapy can prevent serious diseases, it might be good. But we don't fully understand the long-term effects, so the potential for harm exists. Third, non-maleficence reminds us to avoid causing harm, and current techniques carry risks like unintended genetic mutations. Lastly, justice asks us to think about fairness. If only wealthy families can afford these treatments, it could create a genetic divide. Religious traditions have their own views. Many faiths emphasize the dignity of human life and the idea that humans should not play God. For example, the Catholic Church sees health treatments that restore health as acceptable but worries about using gene editing for enhancement or choosing specific traits. They believe every person should be accepted as created in God's image. Protestants often focus on humility and caution about human hubris, warning against overstepping natural limits. Jewish ethics value healing and saving lives, so if germline therapy can prevent disease, it might be seen as a duty. But safety concerns remain. Islamic scholars generally permit medical treatments to cure illness but are cautious about altering God's creation because of potential unknown effects. To find common ground, many suggest limiting germline gene therapy to treating serious diseases only. This way, we focus on healing rather than enhancement. Both medical ethics and religious teachings agree that safety must come first. We need thorough testing and long-term studies before moving forward. Society can also set rules to protect future generations, like requiring informed consent from parents and ensuring strict safety standards. Justice is important too. Treatments should be accessible to everyone, not just the wealthy. Most countries currently restrict or ban germline gene therapy because of these ethical and religious concerns. Governments recognize that the risks and moral questions are too great at this stage. Healthcare providers should respect patients' beliefs and discuss these issues openly. Engaging religious leaders and ethicists in policymaking can help create guidelines that honor both scientific progress and moral values. In the end, balancing germline gene therapy with religious views is about respecting human dignity, exercising humility about our knowledge, and making careful choices. By focusing on therapeutic uses, ensuring safety, and promoting fairness, we can work towards solutions that honor both science and faith. This way, we can move forward responsibly, keeping in mind the profound impact these decisions have on individuals and future generations.